Chia and flaxseed are among the best food for heart health, cholesterol control, and constipation. But if you use them incorrectly, you can lose most of their benefits. Today, I will explain how and when to take chia and flaxseed properly. Chia and flaxseed are often mentioned together because they have surface level similarities. Both are healthy, both are affordable, and both are suitable for people with diabetes. However, they have important differences. Chia is mainly for people with high blood glucose level or excess body weight. Flaxseed, on the other hand, is used for more cholesterol reduction or high blood pressure control. Now, let's go through each one in detail. Chia seed. The main effect of chia seeds is stabilizing blood glucose levels. This is especially important for people with overweight or insulin resistance. Chia seed has ability to absorb water and form a gel-like mass in the gastric. As a result, stomach empties more slowly and carbohydrates are absorbed gradually and evenly. Chia can reduce post-meal blood glucose spikes about 30%. It also increases feeling of satiety, which nearly 70% of people report. This happens because the gel is formed by chia stretches the stomach wall and stimulates release of satiety hormones. Chia can also help lower cholesterol. Its soluble fiber binds to bile acids, forcing the liver to use cholesterol to produce new bile acids. Because of this mechanism, chia can reduce low-density lipoprotein cholesterol by around 5%, which also reduces overall cardiovascular risk. Chia improves constipation as well, because both soluble and insoluble fibers feed beneficial gut bacteria and improves stool formation. It can also slightly lower blood pressure, approximately 5 millimeters of mercury. Now let's say how to take chia seeds. The best way to take chia seed is soak 1 tablespoon of chia, about 15 grams, soak into 1 glass of water or yogurt, ideally overnight in the fridge. In this form, chia becomes easier to consume, easier to digest, increases fullness, and significantly reduces the risk of bloating. More than 2 tablespoons per day is not recommended. The higher dose does not provide better metabolic effect. The best time to take chia is before carbohydrate-rich meals, about 15 minutes before eating, ideally during the first half of the day. You can mix chia with oatmeal, yogurt, kefir, or other smoothies. To say simple, chia makes almost any sweet meal metabolically healthier. Chia is safe for consume daily. Important safety points: don't eat chia dry because it can cause choking especially in people with swallowing difficulties. Don't exceed 30 grams per day because higher amount may cause abdominal pain and even worsen constipation, while doses below 30 grams usually improve bowel movement. Increasing the doses don't increase the benefits. Take chia 1 to 2 hours away from medication, so it does not reduce drug absorption. Evening intake is not recommended because delaying gastric emptying and nighttime fermentation may cause gas and disturbed sleep. Yes, chia contains omega-3 fatty acids, but it is not the same found in fish oil. The omega-3 in the chia has only about 5% biological effectiveness compared to fish-derived omega-3. Chia may slightly reduce absorption of minerals like iron, zinc, and calcium. It's important to understand that chia does not directly cause weight loss, so expectations should be realistic. Start with 1 tablespoon and increase the dose after 1 week to allow your digestive system to adapt. Always drink enough water with chia, at least 1 full glass, otherwise it may worsen constipation instead of helping it. Now let's talk about flaxseed. The main function of flaxseed is cholesterol reduction. It is one of the strongest natural cholesterol-lowering food outside of medications. This effect comes from its soluble fiber and lignans, which binds bile acids and increase cholesterol excretion. Flaxseed can reduce bad cholesterol around 15%, which is excellent result. It can also reduce blood pressure. Lignans improve endothelial function, leading to reduction about 5 to 10 millimeters of mercury. Flaxseed improves bowel movement, stool formation, and stool softness. It is one of the best for people with chronic constipation. Flaxseed has a unique property. Its lignans are converted by gut bacteria into phytoestrogens, plant compounds similar to estrogens. If a woman has high estrogen level, flaxseed reduces estrogen activity. If estrogen levels are low, it acts as a mild estrogen. This effect is called hormonal modulation. Flaxseed fiber and lignans also bind estrogen that are excreted into bile and help remove from the body. Because of this mechanism, regular flaxseed intake may reduce risk of breast cancer. Flaxseed also increases sex hormone binding globulins. This can slightly reduce testosterone level in men, but without any clinical significance. In other words, flaxseed does not reduce libido, does not affect erection, and has no meaningful negative effect on male sex hormones. Flaxseed also has appetite suppressing effect, insulin resistant improving effects, and anti-inflammatory properties. Now let's say how to take flaxseed. Flaxseed must be ground. Whole flaxseed pass through the digestive system almost completely undigested. The optimal daily intake is 10 to 20 grams, approximately 1 to 2 tablespoons. More than 2 tablespoons per day is not recommended because side effects increase without additional benefit. It's best to intake in the morning or midday. Evening intake may cause bloating. Ground flaxseed should be taken with 1 glass of water. Once ground, it can be stored in the fridge up to 1 month. Whole seeds can be stored much longer, for several months. Flaxseed can be mixed with yogurt, kefir, or matsoni. It is especially effective with oatmeal because the cholesterol lowering effect becomes more stronger in combination. Flaxseed is particularly helpful for people prone to constipation. Flaxseed oil does not provide same benefits because fiber and lignans are lost. Long-term use is possible, but short breaks are recommended. For example, 5 days per week, you can intake flaxseed instead of 7. Both chia and flaxseed should be taken 1 to 2 hours away from medications. And finally, can they be combined? Yes, they can. However, the best practice is alternating them, not taking both every day. For example, 3 days chia, 3 days flaxseed, 1 day break.